morning everyone present here. So I'll be presenting my study on hesitancy and motivational factors for COVID-19 vaccination among patients who attended KAUR hospitals. I have no conflicts of interest to declare. So we all know there was a significant reduction in mortality and morbidity before and post vaccination for COVID-19. So in India presently only 390 million people have received double vaccination. Though these numbers look impressive, but we need to realize that these numbers are from a country with a population of 1.36 billion. So there are several factors which hamper the vaccination drive. A survey in United States of America revealed the vaccination hesitancy to be as high as 27%. So we did a study in a cross-sectional manner, which was a questionnaire-based study. The patients were telephonically asked questions by trained study coordinators in the month of June 2021. So there were a total of 36 questions divided into 5 sections focused on patient demographic, health status, awareness about the vaccination, the hesitancy and acceptance factors, and general perception about the vaccine. So the study was conducted in 6 tertiary eye care hospitals and 1 secondary eye hospital in South India. Patients aged over 18 years and who were able to understand the local language were included. The exclusion criteria was patient who denied participation in the study with no personal mobile phones, with any hearing problems, those who presented with any emergency ocular condition, or those who were systemically unfit. So at the time of the study, 11.2% of the patients gave history of previous infection with COVID-19, and there was a history of 20% of COVID-19 in one of their close family members. The risk perception for getting infection was present in less than 50% of the cases. We need to realize that this data is coming from the time when COVID-19 was at its peak in our country. And 44.2% of the patients were vaccinated against COVID-19 at that time. We noticed that the acceptance for vaccination was better in the elder age group. Males were 50% vaccinated in comparison to only 38% of females. And the vaccination acceptance was better among the higher income groups. It was also better with the more educational background and people who were coming from the urban areas. So the most important motivational factor we found in our study was the fear of getting infected or infecting any of the family members. 28% believed in the safety and efficacy of the vaccine. Another 12% got vaccinated because they were motivated either through the social media or family or friends. 6% got themselves vaccinated as it was mandatory by their employer, and then there were other few motivational factors. The most important hesitancy factor was the fear of side effects post-vaccination. That was in 17% of the study population. 13% gave history of prior vaccine-related side effect because of which they were afraid of getting themselves vaccinated. 13% had systemic comorbidities. Around 15% believed that vaccines were not effective and safe for them, so they were hesitant in getting vaccinated. So 77.2% of the population felt that the vaccines have been sufficiently tested and are safe for human use. Only 56% of the population was aware that even post-vaccination they can get infected with COVID-19. 72% denied any bad experience post-vaccination. 75% of the patients believe that sufficient information is available related to vaccination to the general public, and 82% agreed that once the vaccination is made compulsory by the government, that only will help in the vaccination drive and eliminating COVID-19. So the most important hesitancy factor noted in our study was the fear of side effects post-vaccination, and this has been similar to studies reported from Israel and Portugal. The most important motivational factor was the fear of getting infected or infecting any of the family members, and the similar results have been published from United Kingdoms as well. So we found that the lower vaccination rates were associated with younger age, female gender, rural residents, lower income, and lower educational background. The limitations of our study were that the statements given by the patients were self-reported and there was no proof check regarding the vaccination status, and we did not differentiate between a single and double dose of vaccination. Further, the improved acceptance among elder age group, it could be related to the government policy of earlier availability to that age group. The strengths of our study were a large sample size of 5,033, the multicentric nature of the study, and we believe eye care patients can represent the general population from tertiary centers. To conclude, we need to create awareness about minor side effects and need to allay the patient's fear to improve the vaccine acceptance. The fear of contracting the disease needs to be utilized to drive the vaccination campaign. And we particularly need to focus on women, people from lower socioeconomic status, lower educational background and from rural areas to improve any vaccine acceptance or per se any new intervention which we want to do as community ophthalmologists. Thank you.
Thank you. Thank you, Dr. Kirandeep. But I do surprise in this beautiful morning. Why are you interested being a community ophthalmologist just to highlight about this COVID vaccination?
Sir, because as ophthalmologists, like we will be doing, we go into community, so we need to, through this study, it is not only about the COVID vaccination, we get to understand about many factors which might be creating hesitance among the general public whenever we want to do any intervention or we want to bring something new. So there might be a lot of hesitancy among the general public. So this will help in understanding, like what we found the most important thing was the fear of side effects or complications. So we need to target that part particularly when we are going into the public area.
Is COVID vaccination certificate is now a must for getting admitted for eye surgery?
No sir, no it is not.
That's why I do surprise with this presentation.
Yeah, for an ophthalmologist, is it necessary to know it's vaccinated or not? Not for nowadays.
Right
Presently it is not, ma'am. When we did the study at that time everything was stopped. So
You have, as a part of a doctor, you have gone to the society to know the awareness of the vaccination.
correct. Not as an ophthalmologist, yes ma'am.
Thanks, presentation.
Thank you.